Welcome to Ngn Nclex case study. We will review a case study simulating next-generation Nclex style questions. It would help if you answered each question in the given module before advancing to the next question. During the Nclex exam, the scenario may or may not include the disease process. As the nurse, you must rely on your knowledge to identify key signs and symptoms to diagnose the patient appropriately. The objectives are: 1. Recognizing signs and symptoms of a disease process. 2. Recognizing trends and changes in the client's condition and intervening as needed. 3. Monitoring and caring for clients admitted to the medical intensive care unit. 4. Implementing interventions to manage recovery from an illness. 5. Evaluate outcomes of care. Case study. The nurse cares for a 68-year-old female admitted to the medical intensive care unit in respiratory distress. Module 1. Question 1 of 6. The nurse's notes reads, 0900. Client was admitted to the ICU in respiratory distress after minimal response to high-flow oxygen for a pulse oximeter reading of 83% in room air. Crackles heard bilaterally in lower lobes with diminished breath sounds in right middle lobe, S1 S2, auscultated, bowel sounds positive in all 4 quadrants, skin warm dry and intact. Vital signs: temperature 99.8 Fahrenheit, heart rate 110, respiratory rate 30, blood pressure 168/90, pulse oximeter is 87% on 100% non-rebreather, pain level 0 out of 10. Laboratory report. Blood gas pH 7.20. Partial pressure of arterial oxygen 75. Partial pressure carbon dioxide 51. Bicarb 26. WBC 35,000. Platelets 250,000. Potassium 4.0. Sodium 140. Magnesium 1.5. Lactate level 4.5. Blood culture positive. Gram-negative cocci. Urine culture pending. Sputum culture pending. Question 1. Which 4 findings are most urgent? A. Blood pressure 168/90. B. White blood cells 35,000. C. Lactate 4.5. D. pH 7.20. E. PCO2 50. F. P.O2 75. G. Respiratory rate of 30. H. Gram-negative cocci. I. Pulse oximeter 87%. The answers are D. P.H 7.20. E. PCO2 50. And G. Respiratory rate of 30. Rationale: the patient has signs and symptoms of infection and respiratory failure. The most urgent findings are related to respiratory failure. Those include a pH of 7.2 indicating an acidotic state, carbon dioxide of over 50, tachypnea, respiratory rate of 30 and a pulse oximeter reading of 87% on high-flow oxygen. The blood pressure is elevated but is not yet critical. Module 2. Question 2 of 6. For each finding, indicate if each finding is consistent with acute respiratory failure or pneumonia. Each finding may support more than one condition. Note, each column must have at least one response option selected. The findings are: crackles bilateral lower lobes, pulse oximeter 87% on 100%, carbon dioxide of 51, and pH of 7.20. The answers for question 2 are: crackles bilateral lower lobes is consistent with acute respiratory failure and pneumonia. A pulse oximeter of 87% on 100% is consistent with acute respiratory failure and pneumonia. A carbon dioxide of 51 is consistent with respiratory failure, and a pH of 7.2 is also consistent with respiratory failure. The rationales are: bilateral crackles can be associated with both respiratory conditions and are common in respiratory illnesses. A pulse oximeter reading of 87% indicates there is a low level of oxygen within the blood, which can be caused by either condition. A blood gas carbon dioxide of 51 and pH of 7.20 indicates respiratory acidosis and are consistent with acute respiratory failure. Module 3, question 3 of 6. What does the nurse determine is the priority for this client's care? Administering corticosteroids to reduce inflammation, intubating for mechanical ventilation support, opening airways with aerosol treatments, or treating infection with antibiotics. The answer for question number 3 is intubating for mechanical ventilation support. The rationale is acute respiratory failure is characterized by the lung tissue's inability to oxygenate properly. The client has had a poor response to maximum supplemental oxygen and now needs mechanical ventilation. The respiratory failure was most likely caused by pneumonia. Treating pneumonia should take place next. Aerosols and corticosteroids may be incorporated into the treatment plan but are not as critical as intubation. Module 4. Question 4 of 6. Previously the nurse's notes read: 0900. Client was admitted to the intensive care unit in respiratory distress after minimal response to high-flow oxygen for a pulse oximeter reading of 83% in room air. Crackles heard bilaterally in lower lobes with diminished breath sounds in right middle lobe, S.1.S.2. Auscultated, bowel sounds positive in all 4 quadrants, skin warm, dry and intact. Vital signs: temperature 99.8 Fahrenheit, heart rate 110, respiratory rate 30, blood pressure 168/90, pulse oximeter is 87% on 100% non-rebreather, pain level 0 out of 10. At 0930. Client was intubated with number 6 endotracheal tube and was placed on assist control mechanical ventilation, rate of 14, PEEP of 5, F.IO.2. 60%. Vital signs: temperature 99.8 Fahrenheit, heart rate 110, respiratory rate 14, blood pressure 180/90, pulse oximeter is 96%. Client is restless. Question 4. The nurse is planning care for the client after beginning mechanical ventilation. For each potential intervention, specify the nursing intervention, whether the intervention is indicated or not indicated to include in the plan of care. The potential nursing interventions includes: administer sedatives, repeat chest X-ray, schedule suctioning every 2 hours, administer amiodarone, administer 4 antibiotics, position supine with head midline, obtain an electrocardiogram. Remember, identify whether the potential nursing intervention is indicated or not indicated. The video will pause for a few seconds. The answers to question number 4 are: administering sedatives, for antibiotics, chest X-ray, and electrocardiogram are all indicated. Schedule suctioning every 2 hours, administering amiodarone, and positioning the client supine with head midline is not indicated. Rationale: most intubated clients require sedation to prevent them from fighting the ventilator. A chest X-ray should be done after intubation to confirm endotracheal tube placement. Suctioning can be damaging to tracheal tissue and should be done as needed and not on a schedule. Antibiotics are indicated to fight infection. Amiodarone, an antiarrhythmic, would not be indicated for this client because no arrhythmia was identified. Positioning the client supine would not be indicated. Semi-Fowler's or prone would be best to help with postural drainage. The client has tachycardia and elevated blood pressure, which makes obtaining an electrocardiogram important. Module 5, Question 5 of 6. The nurse receives orders. Which 3 orders the nurse should implement first? The nursing orders includes 1. Insert urinary catheter. 2. Suction endotracheal tube as needed. 3. Titrate oxygen to keep pulse oximeter above or equal to 95%. Medication orders includes 1. Start, IV, of 0.9% normal saline at 75 ml per hour. 2. Give amoxicillin 500 mg, I.V, piggyback every 12 hours. 3. Give midazolam 2 to 4 mg for push every 1 hour as needed for agitation. 4. Give acetaminophen 650 mg per rectum every 8 hours as needed for temperature over 100.8 Fahrenheit. And monitoring orders include 1. Perform 12-lead EKG electrocardiogram. 2. Call for chest X-ray. 3. Have respiratory do a blood gas in 30 minutes. Question 5 answers are: Start, IV, of 0.9% normal saline at 75 ml per hour, midazolam 2 to 4 mg, IV, push every 1 hour as needed for agitation, call for chest X-ray. The rationale is: a chest X-ray is needed after intubation to determine optimal endotracheal tube placement. The client does not yet have venous access. This should be established immediately so medications can be given. The blood pressure and heart rate are significantly elevated, and the client is agitated. Sedation should be given to decrease agitation and risk of self-extubation. Next, an EKG can be done, and antibiotics can be given. The oxygen level is above 95%, so adjustments are not needed and there is no indication suctioning is needed. The blood gas is not due. The urinary catheter can be placed after other treatments. Module 6. Question 6 of 6. Trending. Following intubation. The nurse's notes at 10 a.m. reads: chest ray obtained. IV, placed and midazolam given. EKG shows sinus tachycardia. Vital signs: temperature 99.8 Fahrenheit, heart rate 100, respiratory rate 14, blood pressure 150/70, pulse oximeter 93% on 60% oxygen, point is drowsy, -1 sedation scale. Question 6 reads: the nurse reassesses the client at 10 a.m. and compares the findings to 9:30 a.m. For each finding below: heart rate, temperature, respiratory rate, blood pressure, pulse oximetry, agitation. Choose to specify if the finding indicates that the client's status has improved, declined, or is unchanged. Video will pause for a few seconds. Question 6 answers are: heart rate, blood pressure, and agitation improved, temperature, and respiratory rate unchanged, pulse oximetry declined. The rationale: the heart rate decreased from 110 to 100 and blood pressure dropped from 180/90 to 150/70, both indicate improvement. The client is drowsy, showing the agitation has decreased. The client's temperature and respiratory rate remain unchanged. The client's pulse oximeter has declined slightly. The nurse should assess the lung sounds to determine if suctioning or ventilator increases are needed. In conclusion, The case summary involves a 68-year-old female who is admitted to the ICU in respiratory distress and ultimately needs mechanical ventilation. The nurse monitors the client's vital signs, selects appropriate interventions and evaluates outcomes of care to determine if the client is improving or not.
Thank you for visiting my channel. I will be posting more Ngn Nclex questions, so please subscribe, like, share, and comment, and let me know what disease process you want me to do next time.
Let me note that the Ngn Nclex item response types includes multiple choice, matrix multiple choice, multiple response select and drop-down close. Drag and drop close. Drop-down table. Bow tie. Multiple response select all that apply. Highlight text. Highlight table. Matrix multiple response. Multiple response grouping. Drop-down rationale. Drag and drop rationale.